Hi, everyone. My name is Maureen Stannard. I'm an oncology clinical research nurse here at North Cotton Cancer Center. I work with Dr. Mary Chamberlain. We did an exercise study for patients going through chemotherapy a few years ago, and I'm going to share with you a little bit of the tools that I first became aware of at that time. Well, thank you all for having me here. I'm really excited to be part of this project and thrilled to see so many people from all over the world here. I feel like I'm preaching to the choir because I can see as the names are coming across my screen here that we have PTs and nurses and lots of trainers. So I don't think I'm going to be teaching anything too new, but hopefully framing it in a way that makes sense with the project that we're working on here. So again, I'm Maureen Stannard. I am a clinical research nurse. This is just one of my studies. I normally do more chemotherapy treatment studies, but I think this is a key part of patient care for cancer patients. Well, for everybody, but in my role for cancer patients. Next slide. So the objectives for today are to explain the rationale for why we would use objective measurements of fitness and to take a look at some of those assessment tools and kind of expose you to the genre of instruments that are available and what to look for. I think I missed a previous slide. I have no disclosures for anything. Next slide, please. So the main rationale is, I think this is all things that people probably do anyway, but my intent is to just formalize it. So again, I'm seeing that there's nurses and PTs and everything, and I think when we first encounter someone that we're going to be working with, we're doing a mental assessment as we engage with them. So we're looking to see how they're moving and how they're talking and the language they use and that sort of thing to kind of size them up. So safety first for everything. So the first thing I think we need to be formalizing is prior to beginning an exercise program is assessing them from a safety standpoint. These are not always your regular 16 to 25-year-old healthy person coming into exercise. They often have a lot of health issues. So do they have any dizziness with movement? Are they unstable with their balance? Do they have jerky or smooth movements? Do they require assistance? Are they understanding what you're asking of them? Are they speaking clearly and that sort of thing? And, you know, it will help to define their baseline fitness. So if they're saying that they want to run a marathon and you're seeing that they're very unsteady, you're going to have to address that first. So it's just kind of a way of formalizing what we're doing anyway. It will help to determine their baseline fitness level so that you can design a plan and compare progress. So comparing for the individual that you're working with as well as groups, so you can you know, maybe at the end of a class, say everybody in this group increased their activity level or their fitness level or whatever the measure is that you're looking at over a 6-month time period or something like that. So again, it's just a way to objectify what you're looking at. The third determinant is whether they are ready for fitness. And I think that there are great tools out there for looking at fitness readiness physically, mentally, and emotionally. You know, are they really motivated, or has their doctor told them one too many times they need to get there and they're kind of coming unwillingly? So I think those are all tools that we can take a look at. Next slide. So I think this first one is the most common that's used. I would guess that most of you have seen it in some way, shape, or form in your practice. This is called the PAR-Q and U, and this is really looking at fitness, physical activity readiness is what it stands for, and it's looking to see, are they really at a place that they can begin an exercise program. I know you probably can't read that very well, but I've put all of these instruments that we're looking at in the on the last slide under resources so that you can pull them up. And this is asking, have you ever had chest pain? Has your doctor ever told you that you should or should not be exercising? Do you have any problems with your bones or joints. Have you ever broken bones? What's your surgical history and your medical history? And it's really just kind of like, this is my favorite because it's just kind of encapsulating everything that we're looking at. And then it will score it and say, if you've had yes to one or more of these questions, you know, you need to proceed with caution. If you say no to everything, you're probably good to go. Or if maybe now's not the right time for you to be starting an exercise program, if you hit too many things positive on this, you know, maybe you need to go back and get a clearance from your healthcare provider or something like that. Next slide, please. This next one is Exercise Motivation Inventory EMI2. And a full disclosure here is I have not used this particular tool, but I began looking for something along these lines as we were, as I was preparing for this. And I see that Kathy Lyons is on, and this kind of falls into her body of research where she's looking at how you create change in someone. So this is looking at how are they really ready, and it breaks it down by different themes. It gets a little complicated. It's a multi-page tool. And as you can see, the Likert scale is 0 to 5. So there, you can end up with lots of data to put into your scoring. And they do have a link in the, this was from the Livestrong website. And they do have a link in there that you can just plug all your information in and it will score it for you. So I think that would be a handy thing. And as I'm talking about going to the Livestrong site to get this, a big thing with all of these instruments that you're going to look at to use, you want to make sure that they've been validated, meaning that they have been put through the paces of rigorous studies to make sure that they are really telling you what you want them to be telling you. So pay attention that you're choosing a validated assessment tool, and make sure that it is applicable for the audience that you're going to be working with. You know, some of them are designed for elderly people or younger people, but not necessarily both. Some of them are for heavy exercises or exercisers or not. So just pay attention that you're using the appropriate tool for the right audience. So make sure that it's a validated tool, it's the appropriate tool, and that you use the entire tool. You can't, if it's something that's been validated, you can't pick it apart and use just sections of it because it's been validated as a whole unit. So those are just some tips. And, you know, trying to find these on different websites, if you choose a reputable website, something with EDU or a healthcare site, those are usually steering you in a better direction. So again, I have not used this exercise motivation inventory tool, but I do like that it breaks it down into themes for what issues people may have in motivation, and it can steer you on, you know, how you're going to approach motivating them. Next slide, please. The Godin Leisure Time Exercise Questionnaire. I really like this. I ended up querying over 100 people in the cancer center here on, after the original study I worked on with Dr. Chamberlain. We ended up saying, what's going on with people? Why are they exercising? How much are they exercising or not? So we ended up approaching, as I said, over 100 people and used this particular tool for just down and dirty. Are you exercising a lot, a little, not at all? I was really struck by how many people are not at all, and had to kind of cover my face that, wow, you really haven't ever, you haven't worked up a sweat in a long time. And then how people define it. So there are good, you know, some people say, well, I rake my leaves, and some assessment tools allow that for exercise and some do not. Some say vacuuming your house doesn't count. It's just part of activities of daily living. But I particularly think when you're dealing with people who are sick and recovering from disease or surgery or treatment, that you need to take all those things into account, because it does matter that they're up and functioning. So this is a really good assessment tool, the Godin Leisure Time Exercise Questionnaire. And you'll see a couple of these that I've used are from the ONS website, and that's the Oncology Nursing Society, which fortunately they are starting to do a lot more with exercise for cancer patients. You know, I think for a long time the sense with cancer patients was, you know, oh, you poor dear, you're going through this and you shouldn't have to do anything. And I think now that we are curing people or prolonging their life for a good long time, as well as understanding that exercise is really important to health and enjoyment of life, that we need to be incorporating that into their healthcare as well. Next slide, please. If you could hit the first video. So these are going to be two videos on two different assessment tools. I would guess the PTs are pretty familiar with this. The first one is the get up and go, or yeah, timed get up and go test.
Timed up and go test. The purpose of the timed up and go test is to assess the mobility, balance, walking ability, and fall risk in older adults. The test measures in seconds the time it takes an individual to stand up, walk a distance of 3 meters or about 10 feet, turn around, walk back to the chair, and sit down. Demonstrate the test to the individual and use a stopwatch if you are able to. The individual should walk a safe and comfortable walking speed. The test ends when the individual sits on the chair. Speak slowly and clearly. Your instructions might sound like this. When I say go, you will stand up from the chair, walk to the mark on the floor, turn around, walk back to the chair, and sit down. Tell the individual to walk at a comfortable and safe speed. I'll be timing you using a stopwatch. Ask them if they understand the instructions and start the test. You might find it helpful if you use a cue like ready, set, go. No physical assistance is provided.
Thank you. So that's a very common one. And the cardiac rehab department here at Dartmouth-Hitchcock has agreed to take some of our cancer patients as they have capacity around their cardiopulmonary patients. And that's one that they use as a standard baseline across the board.
The 6-minute walk test is a type of exercise test. It measures your ability to walk or exercise. It measures the maximum distance that you could cover while walking as quickly as you can on a flat, hard surface over a period of exactly 6 minutes. You should take all your medication as usual and as prescribed. You should eat a light meal 2 to 3 hours before the 6-minute walk test. You should not exercise vigorously for at least 2 hours before the 6-minute walk test. You should wear loose clothing and wear shoes that are comfortable to walk in, like tennis shoes. You may use a walking aid if it makes you feel safer or more steady, such as a cane or walker. If you normally use oxygen to walk, you may perform the 6-minute walk test while you are wearing oxygen. You may need to carry or push your oxygen tank. A technician will carefully explain the test to you and ask if you have any questions. Your blood pressure, heart rate, breathing rate, and blood oxygen levels will be measured before the test. You will have to walk as quickly as you can along a corridor of 30 to 50 meters. At the end of the corridor, you will turn quickly around a pylon without pausing, and then continue walking. You should try to cover as much ground as possible in 6 minutes. However, if you feel short of breath, have chest pain, or feel faint or dizzy, you will be able to rest briefly before starting to walk again. The technician will not speak to you during the test or encourage you. You should not speak to the technician or your friends and family. The technician will only tell you that you have 4 minutes left, then 2 minutes left, then 15 seconds left, and finally, to stop. A scale will rate your degree of breathlessness as well as fatigue level. Your blood pressure, heart rate, and breathing rate will be taken after the test.
So those are the two most common ones that I think are used, that are up and active ones as opposed to a questionnaire kind of thing. So I wanted to share those. And again, everything will be in the final slide for resources. I hope that's helpful.